time to hear from our second keynote speaker, Jordan VanName from FusionIQ Nursing Solutions. Allow me to introduce her. Jordan VanName is a seasoned healthcare leader and clinical expert with nearly 2 decades of experience on the front lines of patient care and specialized medical operations. As the founder of FusionIQ Nursing Solutions, Jordan leverages her extensive background to bridge the gaps between clinical excellence, operational efficiency, and regulatory compliance. Jordan's career began in 2007 at UNC Chapel Hill. After graduating from Alamance Community College and later South University, she began her nursing practice in 2011 at the prestigious North Carolina J.C. Burns Center. Her clinical expertise spans high acuity care, specialty nursing, travel nursing, rare disease home infusion, and specialty pharmacy operations. The inspiration for FusionIQ came from Jordan's firsthand observation of fragmented industry, identifying a critical void in cohesive clinical and operational leadership. Driven by a mission to eliminate operational inefficiencies and improve data utilization, she founded FusionIQ. Today, she consults for healthcare agencies, pharmacies, and manufacturers. Beyond her professional achievements, Jordan is a dedicated wife and mother to 3 children under the age of 10 and enjoys gardening and the beach with her family. At this time, I request Jordan VanName to kindly deliver the keynote presentation.
Hi everyone, how are you? Awesome. So my name is Jordan. I am an entrepreneur, so this is new for nursing. So I am a nurse entrepreneur. How many other business owners do we have in here? Okay, awesome. This is phenomenal. So I am a consultant. I do healthcare business coaching as well. And what I've noticed is I see a lot of issues because we come in as nurses. And what we miss is that we forget that as nurses, we learn very quickly and we don't know business, right? I did not go to business school. I went to 2-year college before I got my BSN, and I have learned how to become a business person and also stay as that important nurse that everybody needs, right? We have patients who still need to hear from us. We have our staff who need to hear from us. And quite frankly, like I have left industries where we've had strong nursing and those nurses were replaced with healthcare administrators who didn't know what we understood. So I decided, as I was in specialty infusion, this is a rare specialty. It fell into my lap in 2015. I was asked to see a home infusion patient for IVIG. They said, hey Jordan, we have a case. I was a travel nurse. I couldn't get work when I came back to beautiful North Carolina. And somebody said, we have a home infusion patient for you. Okay, this is my first time as an independent contractor, didn't know what that looked like. Looked up this drug because that's what we do. Learned everything I could about home infusion in about 24 hours. Went to see my first patient. I'm excellent with IV skills, so this was not too hard. I walked in there, I can assess, I can start an IV, and I learned this drug. Once I saw this patient, I realized this was my industry. I did critical care, I love it. It wasn't for me anymore. At the time, I was pregnant with my first daughter. I did not want to rotate shifts, and I did not want to work 12-hour shifts. Goodbye. So I decided now is the time to start this home infusion journey. And it really has changed over the past 11 years. And I decided that I needed to step up and become a nurse entrepreneur to help other business owners, to help them see that you can be more than a nurse. You can be an entrepreneur. You can learn the business. You don't have to go back to school for that, although I recommend it, but you don't have to. We can get there. You can be that patient advocate. And I do this through a process that we're going to talk about today called Business Vitals. And it just kind of helps you to understand your business like a patient. That's how I think, still think to this day. So I think of my business as a patient. So we're going to go through that here today. Excuse me if I get this wrong. I was like, hey, there we go. So the challenges that we typically see, and we see this more than home infusion, right? We see this in hospitals, we see this in nursing homes, but it's fragmented management, creates operational silos, revenue leakage, especially through intake and billing. Billing is kind of a nightmare for any of us who've had to deal with that. Compliance gaps, and nursing burnout and high turnover. That one right there, huge. I am not a fan of losing nurses. I like to keep every nurse that I retain. It may have stopped working on me. Okay, it's going to restart on me. So I'll give that a second. There it goes, coming back up. It went back a couple here. All right, so operational strategy is what I call our circulation. This is what we need, your day-to-day operations, right? So when we look at this, we are looking to how are you getting your intake of patients? This can vary, right, depending on what setting you are in, and what kind of workflow design to ensure that you have the revenue, that you ensure that you have the ability to prevent having to rework your operations. Strategic marketing and positioning. This is a huge tool that is often missed across every industry. You see your corporate giants do this, but if you own your own business right now, I'm here to tell you, please look at your free industry needs, right? You have LinkedIn, you have Facebook, you have TikTok. You feel free to look at, these are free marketing tools. Just be cautious in what you say, obviously, right? But if you were there to get the business, this is how you're going to start obtaining it. The outcome of this is we would want to start capturing more revenue. We do not want to lose any more referrals, and we want to try to predict what is occurring. So that being said, when you think about this, we have to think of our operations somewhat as businesses. Yes, I am a big advocate of patient first. I say this a lot. In my industry, pharmacies are our payers. We don't deal with insurance. So pharmacy is our payers as a nursing agency. Then comes nursing, and then comes the patients. And the way I look at that is we have to make sure that we're not only pleasing our payer, pleasing our nurses, but also pleasing our patients. So we do a nurse match. They don't just get the luck of the draw. We do try to match patients to who's going to fit them best. This nurse is going into their home. They are representing my agency. What is going to make this a good match? So we call patients. I think there is a lot of value in speaking with patients, as I think that was pretty clear on the last presentation as well, and it's something that we miss a lot in our operations. So we really want to try to make sure that we are hitting those markers. Let's see if we can get this to go. If not, I'm pretty good at winging things, so if not, we're just gonna wing it. You're doing awesome. Thank you. All right, if this pops up, we're gonna talk about the next one, after circulation, which I believe I have as clinical intelligence. So I consider this our immunity. In my industry, we follow IGNS guidelines. That is primarily for immunoglobulins and infusion therapy. And what are we using from those tools? Lots of us have probably lots of letters behind our name. Are we taking that information that we are learning and applying it to what we are doing? It is important that we take the best parts of that and apply it to what we are doing. That will help you stay compliant. And then obviously we have our early warning system. What do you do with that? So I use data. I am huge on computers. I like to use my data to tell me where I'm going. And you can do this even with patient metrics too. You can trend your patient's vitals, see where they're going. I think we often ignore some of these tools that are there, but they're there to help predict some of our outcomes. So for us in my industry, we like to use our clinical data. Are patients being compliant? Are they sticking to their appointments? Are they improving? It is important that we're documenting. Do these things help them to improve? And the other part of that is looking to see, are our nurses being compliant? Are we getting their certs on time? Are they trying to further their education, or are they looking for more? So those are the data trends that I like to use to make sure that this business is staying operational. And then nurse consultants, I recommend if you don't work with a nurse consultant, talk to me. Nurse consultants can really help you understand your business. Even if it's not something we do, we understand the businesses enough to understand that you need to go from this clinical outcome operations and make it functional operations for the rest of your team. Growth and culture. This is my nursing one. This is where I like to bring in more than our nurses. I think we often forget that when we run a business, we have lots of pieces that are integral to that. In my industry, we have our billing team. I love them. We have your staffing team. Please, love you too. Those two pieces are very important because that's the money going in and the money going out. So those two people are very important to me when I am in this business. And I like to make sure that they feel well treated and well respected. And guess what? I don't staff patients all day, every day. Have I? Yes. Do I do it? No. So I want to hear, what do they hear? They hear the trends first. They hear from patients. I've worked with nationwide companies. I am from Florida. Florida patients, that's a whole nother country pretty much if you guys are not aware. But you have Florida down here, and we're just Florida people. And then you have a whole nother section of the country, right? We have the South with like our Bible Belt, and I know we hear about these things, but the way people talk and communicate are very important. And guess who hears that first? My staffing team. They hear that. They go to the Northeast. It's very different. And guess what? Your nurses are the same way. So the way we communicate is going to be important. You go out west, you got to be aware of their schedules, what's happening there, nursing laws and restrictions, things that happen that you don't think about. And it's important that we take that into account. And then what I like to do with companies is, who's tired of getting pizza for Nurse Appreciation Day? I am. Please. What do we want? We want a gift card. We want money. All right? Yes, we love what we do, and we love seeing the better outcomes for patients, but we don't feel appreciated when you throw food at us. And I like to come to companies and let them know that your nurses are valued. And the ways that I like to do that is bring them into your operations. Why are we not asking the people who are servicing our patients? Why? This has to be a standard. So I ask nurses, and I let them know, there are going to be people who fight you. I see this a lot. Nurses fight back. They are stuck in what they're doing. They don't want to hear you. But guess what? I can learn to appreciate that too. Something worked for them, and they enjoy it. So things that I like to do to kind of help make sure that we are engaged. If you don't have a nationwide company, how can we engage these nurses? And some of those may be like community picnics where they invite their families. I am not opposed, I know that this might be a little bit different, but I am not opposed to your children seeing what you do for a living. I have 3 kids, 2 of which came pre-COVID. I have a 10-year-old who can access support sterilely because she watched me do it virtually with patients. So there is nothing wrong with your children seeing what you do. I probably have a future nurse or doctor on my hand from that, right? I think it's important that when you see the nurse, that you're not just inviting the nurse, you are inviting that husband, that partner, best friend, your kids, and letting them see who you work with every day and why that's important to you. Because guess what? We work for them, right? Essentially, we need to work for money. We work for our passion as well, but ultimately, it is providing to them in some way. So I like to make sure that we can try to engage our team. Sometimes it's our admin team who gets together. Sometimes it's our field nurses. How do we bring them together? So on nationwide companies, one thing I like to do is put together like contests, photo contest. Let's make a calendar, right? What have you seen while you were driving to see these patients? Bald eagles, dolphins, million-dollar homes, celebrities. What have you seen so that we can make a calendar and we can give you the credits for that? As a company, nurses do many things, and one thing I like to find is, what else do you do? When you are not nursing, do you craft? Do you make ornaments? Have them make you your ornaments that you send out to everyone, right? Inspire them to do other things. So, chronic inflammation, this is all of our favorite term, I think. We see this a lot, but where are we failing? And so it's important when you bring in a consultant that they identify where you're failing. A consultant's going to tell you the things that you probably don't want to hear, but you're going to hear it. And I get a lot of pushback frequently from clients because they're like, no, this is what I want, this is how I've had it. It's working well. If it's working so well, why'd you call me? It doesn't work, right? There's something missing in that. Sometimes we have to learn to bend, and that's what a consultant's going to do. They're going to peel back your eyes to say, look, that may have worked initially. It does not work now. Compliance gaps. Yeah, you may have this note and nurses are turning it in, but you are missing critical pieces of information that is setting you up to either get sued and lose your business totally. As a small business owner, you can't afford a single lawsuit, right? So it's important that you make sure that that's there. Finding a policy. I walk into many companies and it's like, well, we're doing this here, and the staffing person's over here doing that, and we have field nurses who are coming in to help, and it's a little bit chaos, right? So what I come in is I make those lines more clear, and I like to give back to the nurses and, hey, you're accountable for this. This is your role and responsibility. Here it is, right? I'm not going to follow up unless I need to. I give you a job. I expect that you do it. Many of us as nurses know that we're going to do it. All right, so the biggest piece of this part right here that I like to talk about is your return on investment. When we talk about nurse consultants, everybody, you know, it's like, why would I need somebody to tell me how to run my business? I can probably Google it. Well, if you could have, you would have. And so the reason why you want to look at a nurse consultant is because we get it done very quickly, something that may take you 6 to 7 months, where you could be having adverse events with patients that aren't being tracked or documented. What does that cost to your company? You lost your patients, you're losing nurses. That's huge. We're coming in, we're setting a policy, we're enforcing it. Retained nursing talent. I don't like losing those nurses because they left because they didn't know who to contact, what to do, right? I want to bring you back in. I would rather put the money in training you and getting you prepared to go out than to lose you for something such as, well, I didn't know who to contact. I love an exit interview. Highly recommend for my business owners, if you're not doing it, put up an exit interview. You may hear things you don't want to hear, but listen. Listen is huge. And then better compliance. With this, everybody has their own compliance that they are following. And I think it's important that when you work with a consultant, you have those ready and available. If you say, I follow these guidelines, you need to have them. We can look at them and interpret them and then put them up there so that we can help you not have issues with payer denials. In my industry, if you are not following soon to be IGNS guidelines, there's a good chance that specialty pharmacy isn't going to lose you, which means you are now losing potential business. So this is where I like to look at data. This is my monthly triage. I tend to look at this on a monthly basis. For a bigger organization, we might look at it twice a month, but most of the time it's just monthly. What kind of volume did we have? What have we done right? It's important to take your positives, right? We got 10 referrals this week. If you got them this week, guess what? It's whatever you did the week before that it helped pour them in this week. What did we do over those 2 weeks that helped bring those new patients in? Where did my nurses complain? Now you want to look at your complaints. Did I have patient complaints? Did I have nursing complaints? Where are we at? If you see a declining metric, you want to catch that sooner rather than later. Many times as a consultant, when I come in, I see metrics that start kind of on the high side and they look good, sometimes not at all. And then all of a sudden, they're flatlined. And I'm trying to bring back a company that maybe has flatlined because they're not getting referrals, they're not billing appropriately, and they're not following guidelines. Their nurses have nothing nice to say. This is horrible, right? But we come in and I fix those things, usually with data. So this kind of gives a timeline. Ideally, if you're, when you put new things into effect, if you look at them, you can't say, I put this new policy and in 30 days, I want to see how it's doing. You're going to need to look at a new policy that you implemented to see over about a 3-month time, because you have to make sure your nurses are trained on it. You have to make sure your staff is cohesive on it. Everybody should be locking arms. There is no exceptions, right? We all lock arms. We all know what we're doing. And then you want to see, are we seeing improvement in that area? If you continue to decline in that 90 days, 30 days you won't look, but in your 90 days, then you probably want to say, okay, we need to change something. So something I like to teach business owners is, because I'm usually not in these places for 90 days, is, hey, here's your data. Look at this monthly. Evaluate, are you improving? You should be trending up. Every industry, I think, has highs and lows of when business is better. For home infusion, the first of the year with insurance is a nightmare. So January and February are typically kind of on the low side, but then it picks up. Slows down in the summer because patients feel good in the summer, they're vacationing, their disease process is improving for the most part. And then they have huge fall-offs in the fall. Kids go back to school, they're making appointments, they're getting new diagnosis, they're starting to feel some of those symptoms come back. Now they have to go back on therapy. KPIs, I feel like this is such a corporate term. And I'm not going to tell you that KPIs are not important. KPIs are important, but you need to set them to what's appropriate for your team. I feel it's best that I have my staffing team set their own KPIs. What do you want your goal to be? As the CEO of someplace, yes, I can have what I want to, but I want to know from the people who are doing this, what are your KPIs? I talk to nurses in the field. What kind of KPIs do you look for? How many cases are you taking? Incidence of infections? What are you looking at? And it's important that KPIs are more of goals that people try to look at and set, and hopefully you can drive to that. As the CEO, it's not me bossing you. I need you guys to feed the input. We're a team, right? That's my field nursing staff. That's my staffing internally. What are you guys seeing and what are your goals? Because if you are successful in your goals, ultimately the company as a whole will be. And I will set those larger company goals. So I kind of talked about home infusion in general. So we have two types of different things that you can look at. I think when they introduced me, we talked about home infusion, specialty pharmacy, and manufacturers. They're primarily the cases I work with. So I'm going to talk about home infusion nursing. And in this, it's typically nurses who run these businesses. It's home infusion nurses who started their own agency, and they're a staffing agency essentially. And they're bringing in other field nurses who have excellent IV skills. And it's important that they learn how to draw in those referrals, but they are nurses first. And so what they're typically looking at and what they deal with is problems with getting cases pulled in. And, you know, I am sure that my team that has worked with me and my agencies, I am not a no person. I like to say yes. I say yes to my children. I say yes, and not always, but I am a yes person. My children, can I go to the park? Yes, you can after you do your homework. All right, makes a difference than saying, no, not right now, later, right? Which one sounds better? Yes, you can after homework. No sounds terrible. Same thing in business. Somebody sends me a case. Hey, Jordan, I'm with CVS Specialty Pharmacy. I have a case in Tampa, Florida. Can you take this case? Yes, I can. On this day, because that's when my nurse is available. I don't say, no, I don't have nursing on that day. Which one sounds better? Even from you guys, right? It sounds better to say, yes, I can supply nursing on this day versus, no, I don't have a nurse for the date you requested. Patients wait months to get seen in this industry. They go through the whole prior auth ordeal. And so it's important that we learn to say yes, because we are getting ready to secure nursing for a patient who needs this rare therapy. And it's important that we learn to say yes, but on our terms. Yes, because of this. I have nursing in this area. I do sometimes have to say no when people are like, Jordan, do you have a nurse in California? No. But overall, I like to say yes. Hey, Jordan, I know you said your nurse could do Tuesday. Do you have something else available? Yes. Let me call someone else. All right, so when we look over your ROI as a business, if you're not currently looking at your return on investment, think of the money you put into your business and what are you getting back from that. You want to make sure that you're operationally strong. This is going to help you set up foundationally. I work with a lot of agencies who are operationally strong. It's the next two that they struggle with. Getting things such as the ability to talk to specialty pharmacies, talking to a doctor. I know we all talk to them, but it is not easy to talk to a physician. surgeons particularly, right? So when we go to talk to people, we have to learn to speak their lingo. And I do the same thing with field nurses, right? So it's important when we look at talking with a pharmacist has no idea what we do in nursing, even at specialty pharmacy level, right? So it's important that we bring the nurse knowledge to them and we bring it in a collaborative environment. And a lot of times it's important that I speak to them in that manner. If I speak to them like I know everything because I'm the nurse, they're done with me. They're never giving me another case. But if I speak to them like, hey, I want to be able to help you, we're engaging, always speak positive. That will keep your immunity high. It's like your vitamin C, okay? So always speak to your payers or anybody who's giving you work. You want to speak to them very kindly. Same way with patients. I agree wholeheartedly with the last keynote speaker. Just sit down and listen to them for 5 minutes. A lot of times we don't take the time to do that, but just listen for 5 minutes. They're going to tell you, I've waited for 7 years to get this diagnosis. I have been misdiagnosed. I have been called a drug addict. You're going to hear them speak on things that you don't realize why they're so grumpy until you hear that. But then you walk in and you're like, I'm going to give you your medicine and I'm going to get you treated and we're going to take good care of you. You are now their nurse for life. In specialty home infusion, we tend to keep our patients for the duration of therapy, which sometimes is lifelong. There's new therapies coming out on the market, such as enzyme replacement therapies. That was a very hard thing for my brain to wrap around, but these patients are frequently misdiagnosed. And it's important that we take the time to listen to them because it's a genetic disorder. They've lost grandma, they've lost brothers, sisters, they couldn't get pregnant. They've gone through ordeals and then they get diagnosed and then they find, oh, I have this genetic disorder. If they did bear children, now they have to, it's a whole mental process. I have to have my child tested. My child is going to have to know about this so that they can tell their children. So it really helps to be patient first and hear them and listen to them. Yes, we do sometimes have to tell them like, we're not going to speak that way. Let's slow down. I'm here to help you. But a simple reminder of, hey, when I'm getting screamed at from a patient, I'm like, hey, I'm here to hear you. I understand your frustration. Let's just tone the language down just a little bit, right? I stay patient focused. That way they understand that I hear them, but I'm not going to deal with you screaming or cursing me. Culture and retention. I think as business owners, I like to take the time to listen to these patients up front so that when I call my nurse, I can tell them what they're dealing with. As a nurse, you guys appreciate a good, handoff on what's happening or a report, kind of the same thing. This is me telling you the struggles that they've gone through, difficulties you may see in the home, making sure their environment is safe before they get there. You never know what you're going to walk into in home infusion, and so I try to put up as many things as I can so that we can make sure that these patients are safe right off the bat, and nurses safe too. And so we try to keep that in mind. That will keep your nurses very happy. All right, so your calls for action. I encourage you, if you do have your own business, or even if you don't, if you work in administration, just kind of take what I'm saying and applying it to where you're at. How is your business doing? How is the company that you work for doing? Are they putting patients first? Are they being advocates for these patients, being advocates for you as the nurse? Even if you're in administration, are they being advocates for you in administration? Encourage them to use a nurse consultant if they are struggling in that. If you see your CEO kind of just being alone, that might be a good indication that they need to speak to somebody else because they are handling a lot mentally. It's mentally straining to run a business and trying to keep all of these pieces functional and satisfactory. If they will, have them speak to a nurse consultant. It can be anybody. I'm sure there's a few here. Have them know who they're speaking to so that they can feel more savvy in what they're doing. Encourage setting up, dashboards. I'm more of a goal set. Have your field nurses set their own goals. If you have your business where you are working with field nurses, they will really appreciate setting their own goals. Quit treating them like they are not driving your company. They are driving your company. Listen to them. Listen to your people in the front, your billing people. What struggles do you have? I like to have one-on-ones. This was huge to the industry that I was in because nobody spoke to their staffing team. Sure, we spoke to nurses. We're pretty good at that. We did not speak to our staffing team who dealt with getting yelled at by patients. We did not speak to our billing team who's getting yelled at by payers. It was important that I stepped in, talked to those people, talk to everybody, make sure they feel satisfactory. And then try to set your businesses and your company up where that you are tracking data. Your data will drive you to where you need to go and where you are going. All right, so that kind of is the end of this, but I wanted to go through that kind of quickly because I kind of wanted to engage everybody here. I do work in a field that is very different from what you're used to. I mean, I've worked in a burn ICU here in beautiful North Carolina. I absolutely loved it, but it wasn't for me long term. So I would like to hear from you guys because nurse entrepreneurship is relatively new in our spectrum. And I do encourage people to take a look at it, understand it, and just kind of let you guys ask me questions if you have them, so that you can kind of understand more. Same with specialty infusion. It is a very small niche that literally we kind of just, I fell into, right? Can you go see a patient? I was recruited for my IV skills. So, there was that specialty. That I don't think we even know about. I have any of you heard of home infusion therapy before, like genetic therapy? So good, not too many of you, but it is super rare to hear about it and know about it and even how to get into it. So I kind of wanted to open the floor so you guys could ask questions. Yep. Anybody? No. Does anybody have, you have a question? Yes. Oh, yes. We are a whole tribe. I know several. So I have my mentor. She is also a nurse consultant, and her name is Danielle Jenkins. She's with Nursing in Style Consulting, and she does various different levels of consulting. Primarily, me and her are very similar. We both found this niche in home infusion therapy, but she was very fortunate to work in the home care industry. So she knows a lot more about home care, Medicare billing and non-medical, non-Medicare billing, concierge nursing. So she knows more in that space. She likes to use that space. I liked for her to kind of do the operations. I primarily will do mostly referral management and nurse engagement. That is my wheelhouse. I like to keep nurses happy because I am that nurse and I like to be happy and I like to love where I work. So that is one. There are several. I see them networking with me more and more, primarily through LinkedIn. You will find a lot of nurse consultants there. I see them for nursing homes. I see them for hospitals. I see them for accreditation standards. So if any of you are accredited in whatever your specialty is, they can use consultants and they'll recommend you on their websites. So those are some that I know about. Anyone else? Yes?
I just wondered how you marketed your business when you started.
Very nervously. Because I was, this is a new industry, right? Nurse entrepreneurship is not easy to do. I'm not going to sit here and say that it's 100% the easiest thing I've ever done. I have 3 kids. I have a husband who's also in the industry. It was very difficult to leave a cushy employee job where I was essentially consulting. And I decided that to get into nurse consultancy and to start my own business, I just had to put myself out there. So I did take a lot of risk initially. And I marketed myself primarily through LinkedIn. I did get a coach. That was the best investment I've ever had, was to get a nurse mentor and a coach to kind of help me along the ways, because you're going to hear no a lot. And I will tell you from a personal level, I've heard no a lot. So I see all of you, out here, and, I grew up here in North Carolina. I grew up in Mount Airy, Mayberry. My mom is still there. My mom is a female firefighter, or was. She is retired now. But I did not grow up in a $1 million home. I was 800 square feet, single mother. I have an older sister who had a baby young. I was a babysitter at 12 years old. I did not get a car when I was 16. I heard no a lot. And not only that, but I heard it even through nursing. I took the CNA course because as somebody who we were struggling financially and had no money, I worked early. You know, I've been working essentially since I was 12. So essentially I've been an entrepreneur that long, I just didn't know what it was called. But I used to market myself for babysitting. And so when I started that, I had my CNA class, and I had a very good teacher, and I went into that level 2 CNA class, who was a very bad teacher. You're not gonna make it. This isn't for you. You'll never make it through. At the time, I wanted to be a pediatrician. You're not gonna be a pediatrician. Think about something else. Okay, great. Fantastic. Next level, go to college. I failed my first year of community college. I know that seems astonishing. How did you get into nursing school? With no's. So I failed my first year of community college because I was working 40, 50 hours a week because I was on my own. So I was on my own. I worked at UNC as a CNA. I worked night shift, double shifts, and I heard more and more there, and I was like, I don't know that she's here, but I did have another person that I knew who knew me as a CNA who could probably share with you that I was probably a mess because I was young. I was 19. I was on my own for the first time. I didn't think I was going to make it. Living in Durham at 19 years old, working on a CNA salary, it's not easy. So I heard no then, and I've started to realize in college that no is not really an answer that I like, and I'm really not going to hear no anymore. So after that, I got into nursing school at Alamance Community College here in North Carolina, and I sat down for that nursing interview. I don't know how many of you had to do that. I sat down for that nursing interview. I am ready. I am finally making good grades in college. Like I'm going to make this happen. She said, you work. You're not going to make it through nursing school. Okay, all right. I heard no again. I'm not going to make it. I'm not going to make it. Okay, I made it. I had a 4.0 through nursing school, by the way. I feel very proud of that because I was told no from the beginning. It is hard. I studied. I worked on an OB unit at that time, and when I was working on OB, I watched the babies. Favorite job ever. This would be me holding those babies with my nursing book on night shift. Put that baby up, wrap it up for the morning. Next day, I would come and sit down again in nursing school, running on, hour 20. I made it. And then I went and worked in the burn center, and I had really great mentors there. It's a really great facility. I can't speak to who's left there now, but at the time it was a fantastic facility, and they really encouraged me to do more. And they said, you're great with IVs. You should join vascular access. You should join the IV team. You should join rapid response. I was given so much, this is what you should do. I did ultimately decide I wanted to do travel nursing and did that. And that's where I realized I can be on my own. And you hear lots of things as travel nurses. You get a lot of naysayers. It just fueled me because by the time that they were all naysayers, we don't want this traveler here. Why are they here? Guess what? They enjoyed me. And so I really took all of those no's and made it to a yes. So the same thing when I became a nurse entrepreneur. I started in November on my own, but I have been an entrepreneur since I was 12. I have been doing nurse consultancy in this industry for 11 years. I just didn't realize that's what it was called. I was a paid employee, but I helped all of those things that I've talked about. Those were my jobs for the 2 home infusion companies that I worked for. And I worked nationwide. I was called an educator. I was called a director of nursing. I was called operations. That's a consultant. They do everything. They're a consultant. Does that answer your question?
It does, yeah, thank you.
You're welcome. Anyone else? All right. Well, I think that's all I have for you guys. So thank you all. I would recommend if any of you have questions, please find me. I would love to answer them. I love to talk. I love to speak. So if you have questions, feel free to pick my brain. I love that. I love to keep going. Thank you.